Alright, this is a quick video on how to use the Estradiol vaginal cream. Very easy, very simple. There are a couple of ways to introduce you to that. When you're first prescribed the Estradiol cream, it comes in a box and it comes with something called an applicator. The applicator is this device that it's made of plastic, and you'll see grading on it. So there's 1 gram, 2 grams, 3 grams, and 4 gram grading on it, and that's what's going to help you measure how much of the cream you're going to be applying intravaginally, and that depends on your own prescription. The way to use it, you're basically going to attach it to the tube like so. Very simple. Afterwards, you're going to squeeze out the estradiol cream. Not going to do it right now, but basically when you're squeezing it out, you'll see the measuring part of the applicator comes down as you're squeezing. So let's say you were prescribed 1 gram of estradiol, you want to see the number 1 there. If you were prescribed 2 grams, you want to see number 2 come out. So typically it is about 1 gram of estradiol cream, and once you see your cream come out here, you're going to release your tube, and you may want to make sure you close it because it leaks when you leave it on its own, and also it's cleaner. You want to make sure everything is clean. So you'll have 1 gram of estradiol at the top here. So one way to do it, you're going to directly insert the applicator into the vaginal canal, and you're going to push the cream inside. So that's the typical way to do it. Usually the tissue surrounding the area will absorb the cream. You might see some leakage. Some women apply underwear lining. You can, just whatever leaks out, just apply it to the surrounding areas and let it leak naturally. But that is not my favorite way to do it. I am not a fan of using the applicator. There are a few reasons. One reason it can be uncomfortable when you apply with a plastic device. This tissue is very raw, very sensitive. Using it can be uncomfortable for some people. Another reason, the reintroduction and the reusage of the same applicator can sometimes cause unnecessary infections. So it's always better to steer away from the applicator. The other way to do it, you can use the applicator to learn what is your prescription dosage. So let's say you were given one gram to apply intravaginally. Once you have that measure, you can just apply it on your clean hand. Definitely pre-wash your hand before, and then you apply the cream on your hand. It typically comes down to a little less than an inch long. And then you're going to use your own clean hand to apply it intravaginally. It doesn't have to go, your finger doesn't need to go very deep in the tissue, or in the vaginally. It's just, about 2 inches in. You're going to swipe through very gently, whatever is left, swipe it through the external labia, on the external vulva. The whole tissue around that area is very sensitive to estrogen and responsive, so definitely want that. And after a while, you can forget about the applicator. Once you learn how much of the cream you need, measuring wise, you immediately directly use the tube to extract the amount, and then easily apply the cream. This way it's cleaner, safer, less uncomfortable, and less discomfort. So that should hopefully help you understand the process. It can be a little confusing in the beginning, but once you get a hang of it, it's very simple and straightforward.